Officials across the country are easing up on coronavirus restrictions, but the CDC says that move is creating a concerning trend among kids and teenagers. Janelle Bluda connects the dots.
A new report has some concerning information for parents. Cases of coronavirus are on the rise in children in the United States. Let's connect the dots. The new information of kids and COVID-19 is coming from the American Academy of Pediatrics. It reports that children of all ages now make up 10% of all cases in the U.S. That is up from 2% in April. According to the CDC, the cases in children started to rise in early September as some returned to the classroom. The Centers for Disease Control does say teens were 2 times more likely to be infected than younger children, and most kids continue to suffer from only mild forms of the virus, with much lower rates of hospitalization and death than adults. While we saw the rise in September, experts say you can't just blame schools for the change in infection rates. This comes as some states relax restrictions and many people report pandemic fatigue. That means parent-approved play dates and sports teams could also be the cause. Connecting the dots, I'm Janelle Bluda for H-Town Rush.
All right, Janelle, thank you for that. We are trying to make sure your families stay safe as the pandemic continues. All you have to do is text the word FACTS to 713-526-1111, and we will send you a link with everything you need to know about cases in our area and also reopening plans.